On April 1st, 1999, the map of Canada changed with the formal establishment of Nunavut. Nunavut, our land in Inuktitut, is the realization of more than 30 years of negotiations and planning by the Inuit of the Eastern and Central Arctic. The 1993 Nunavut Land Claims Agreement included a political accord that provided for the establishment of the new territory of Nunavut, and through this, a form of self-government. The Inuit, who represent 85% of the population in the territory, chose to pursue their aspirations to self-determination through a public government structure that represents all citizens of Nunavut, Inuit and non-Inuit alike. However, along with this new self-government has come the challenge of confronting the extreme health issues which plague modern Inuit society. The rate of tuberculosis among Inuit is 185 times higher than Canadian-born non-Aboriginals, having doubled in the last 4 years. Type 2 diabetes and heart disease also severely affect the Inuit at a greater rate than the average Canadian population, and these ailments appear to be on the rise. 72% of Inuit smoke, with smokers present in over 90% of Inuit households, setting an environment in which children start to smoke at a younger age than anywhere else in the country. Households in Nunavut are 7 times more likely to be food insecure than any other household in Canada. These and other health problems have vastly affected the health of Inuit children. Infant low birth weight in Nunavut is 1/3 greater than the national average, while over 48% of Inuit infants have been shown to test positive for anemia. 95% of Inuit children in Nunavut have experienced dental decay, while 60% of these children under the age of 6 undergo dental treatment in the hospital under general anesthesia to treat their decayed primary teeth. Environmental concerns, such as contaminants and climate change, are having a disproportionately high impact on the health and well-being of Inuit people. The fact that 95% of the Arctic is now open for gas and oil exploration promises to further these detrimental effects. These health ailments have taken their toll. Inuit life expectancy is 13 years lower than the Canadian average, and at 67 years is actually on par with the Canadian national average in 1946, over 60 years ago.
And tutting my heel and strutting my feet. Is there anything I can do for you, dear? Is there anyone I could call? No, and thank you, please, madame. I ain't lost, just wondering. Round my hometown, memories of phrase. Round my hometown, ooh, the people I've made. How the wonders of my world, how the wonders of my world, how the wonders of these world.
Severe unemployment, extreme school dropout rates, limited economic opportunity, and the significantly high cost of living in Nunavut all negatively contribute to the health needs of the Inuit people. The solution to these problems will be no easy feat. Nunavut's isolated location automatically predisposes its health services to require greater monetary expenditures.
And everybody taking different sides shows that we ain't gonna stand shit.
According to the National Aboriginal Health Organization, the recruitment and retention, as well as salaries, of healthcare professionals are higher in Nunavut than anywhere else in Canada. The alternative? medevacing a patient out of the territory for care entails a costly sum of a minimum of $12,000 to $15,000 or more per round trip. In the fiscal year of 2006 to 2007 alone, the Nunavut government spent an unsustainable $42 million on medical travel for its residents. As the fastest growing society in Canada, Nunavut is also the youngest. Half its population is under 21 years of age. Its future generations depend upon reliable and efficient health services, capable of addressing both current issues as well as those that lay ahead. The government of Nunavut has stated its mission: to promote, protect, and provide for the health and well-being of Nunavut residents in support of leading self-reliant and productive lives.
Oh, my world.
However, this goal will only be achieved if the people and government of both Nunavut and Canada stand up and recognize that which is afflicting the Inuit people.